Well, since measles is having a bit of a comeback moment right now, let's talk a little bit about measles history. The year is 1757, and this guy right here, Francis Holmes, a Scottish physician, finds out that measles is caused by an infectious agent in patients' blood. In 1912, measles became a nationally notifiable disease, meaning that healthcare providers and laboratories had to report their confirmed cases. In the decade following the reporting, there was an average of about 6,000 deaths each year related to measles. In 1963, a vaccine became available, and the decade before, nearly all children had measles by the time they were 15 years old. It is estimated that about 3 to 4 million people in the United States were infected each year. And of the reported cases, about 400 to 500 people died each year, about 48,000 people were hospitalized each year, and about 1,000 people developed encephalitis or swelling of the brain each year. In 1954, John Enders and Dr. Thomas Pebbles collected bloods from students during an outbreak of measles in Boston, Massachusetts. They wanted to isolate the measles virus in order to make a measles vaccine. They succeeded in isolating measles in 13-year-old David Edmondson's blood. In 1963, John Enders and colleagues took their Edmondson B strain and transformed it into a vaccine and licensed it in the United States. In 1968, an improved and even weaker measles vaccine was developed by Maurice Hillman and colleagues and distributed. This vaccine, called the Edmondson-Enders strain, is the only one that's been used in the United States since 1968. In the United States, the measles vaccine is available in the MMR vaccine, or measles mumps rubella vaccine. In 1978, the CDC set the goal to eliminate measles in the United States by 1982. Although they didn't quite hit that mark, in 1981, the reported number of cases was 80% less than it was the year before. However, in 1989, a measles outbreak amongst vaccinated school-aged children led the Advisory Committee of Immunization Practices, the American Academy of Pediatrics, and the American Academy of Family Physicians to recommend a second dose to all children. Following widespread implementation of this recommendation, as well as improvements on the rate of first-time doses, there was another decline in cases seen. Measles was declared eliminated in the United States in 2000. This was thanks to a highly effective vaccination program in the United States and better measles controls in the Americas. But of course, our story doesn't end here. And since then, there have been outbreaks of measles due to vaccination hesitancy, and we're seeing one right now.